The World Health Organization has declared monkeypox a global emergency, and now a baby and toddler here in the U.S. have contracted it. Dr. Monica Gandhi joins us from Calcutta, India, to break it all down. Dr. Gandhi, thanks for joining us. I know you're there partly on vacation and also for work. We really appreciate it. First, tell us what the CDC is saying about these two children who contracted it. Will they have long-term issues? What kind of an effect will they have? Will this have on them long-term?
So actually the monkeypox outbreak in general, though it's very large now, 14,000 cases in 78 countries, has been generally mild. And I would expect that for the two children. One's an infant, one's a toddler, and monkeypox usually doesn't have long-term consequences. So we're hoping for mild symptoms in these two children. Even herpes, other sexually transmitted infections, just from being close to someone, household transmission, you can get it. And presumably that's what happened with these two children.
So what are the symptoms? What are the treatments and how effective are those?
So there was a very good study in the New England Journal on July 21st that went over the clinical symptoms in this current outbreak. 528 individuals were summarized. 98% were men. The majority of these cases, more than 98%, are in men who have sex with men. And the clinical symptoms are essentially lesions, which can extend from flat lesions called macular to pustular, which look like little pus-filled blisters. Unfortunately, of those lesions, 73% of them were in the anal and genital area, which can be very sensitive area, obviously. There are some oral lesions, there are big lymph nodes, and then there is also fever in 60% of cases. So those are the main symptoms of this. And there is a treatment. If you have lesions at multiple places, there's something that we're actually calling TPOX, but it is actually known as tecovirimat. It's pretty easier to get now from the CDC than it was. And the main thing to do is vaccinate. And who is that? Mostly men who have sex with men, because that's the main community in which it's circulating.
And you have said there are similarities between the early days of HIV and monkeypox. In the early days of HIV, there were a lot of missed opportunities to get effective messaging. Can you talk about the differences between the handling of these two outbreaks?
Yes. I mean, at the beginning, it was so confusing with HIV, and it should never have said, oh, everyone's equally at risk. Yes, there are two children that have been infected, but in general, over 98% are in the LGBT community, and specifically among men who have sex with men. It's important to message that's the risk, that's the community most at risk, because then we can target resources there. If it gets into the general population through sexual transmission, we'll give vaccines to the general population, but you need to target where things are happening the most. The same happened with COVID. Younger people were less at risk. We needed to do most of our targeting to older people.
The CDC, again, leading efforts on this outbreak. Dr. Gandhi, what concerns you about how this has been handled so far? And what do you think we can expect in the future in regards to monkeypox?
You know, I think the CDC, there's been enough commentary at this point that there needs to be some sort of look at their responses, because what happened is that it was immediately obvious that contact tracing and testing was not going to contain this monkeypox outbreak. Testing, we didn't have enough tests. Tests were taking 6 days. That was through the CDC. That was just too slow. Then it became obvious, okay, if you can't contain it with testing and contact tracing, you need enough vaccine supply. The Ghebreyesus vaccine was being made in Denmark. The FDA was taking a long time to get those doses. That is too slow. We needed to have gotten these doses. People shouldn't be waiting 9 hours for a vaccine in New York. It needed to be faster.
And have we had any deaths in regards to this here in the U.S.?
So no deaths in the U.S. Out of more than 14,000 cases, 5 in Africa have died. To be fair, though, in Africa, there is a clade that is a little more dangerous. It's called the Congo clade. So that was more expected if that is that particular clade. Otherwise, the symptoms have been pretty mild, but quite uncomfortable. No one should have this. We should vaccinate all gay men.
And then when you talk about testing, where do you go for this?
So right now, the testing is really actually of a lesion, which is a little confusing too, right? Because you have to have the symptoms. That's different than COVID.
Right.
And you can go to a clinic. You can go to mostly an STD clinic. I would really recommend the municipal STD clinic in your town. They unroof the lesion and they send it. Now the CDC is working with LabCorp, so there's more testing capability. And there is a saliva-based test, but it's not being used as much as it should. Right now, it's almost like we're going to be doing prophylactic. Instead of testing, if we vaccinate all gay men, that's our biggest hope to contain it.
All right, Dr. Gandhi, great to talk to you this morning. Always good to
Thank
get your
you.
expertise on this. Thank you so much.